Hello, right, so my name Cheryl Best, and I'm trained as a nutritional therapist and a yoga teacher, and I write and speak about health and wellness, and I also write and speak about living with chronic illnesses. So I'm going to be talking today about how we can kind of bring like modern medicine, as in conventional medicine, and like holistic practices together, and how these two things really should be working together and how they can work in tandem. And it's come about, if you've not heard me before, I tend to write posts first, and then from that post, then I'll get on here and talk about it. And so I wrote a post based on a YouTube video that was served to me. You know, YouTube's got this fantastic way of like pulling you into these videos and serving you these videos. And I did wonder at first, why on earth is this video being like served to me? Because it was this man who was with his dog, and he was in the mountains somewhere, and it was like, it looked glorious, but I was wondering, like, you know, what's this guy going to be talking about? And anyway, once when I got into the video, into about 5 minutes of it, I'm going to put a link to the video as well on this podcast, and if I post it on YouTube, there'll be a link as well in the description area. But anyway, this video, it was from an ex-neurosurgeon, and he was explaining why he left the medical profession, and he explained really that he didn't believe in the surgery that he was carrying out. And so his surgery was all about fixing backs. And then I realised, okay, now I know why you've served this thing to me, because I have an issue with my back, and I have 4 bulging discs, 2 in my neck, 2 in my lower back. And I've been talking quite a bit about my back as well, because I have other chronic illnesses, but this is the latest one that's kind of been a bit more bothersome for me. And I'm kind of like finding my way now of things that I can do to help beat this one, because I have been practicing yoga for many, many, many years, but my current yoga practice is possibly triggering things. And so I've had to adapt things when it comes to the way that I exercise. And a big thing for me has been walking. Walking, has been fantastic as my way of relieving pain, and has been fantastic for the stiffness that you get with this condition, because it's horrible. And also, alongside the bulging disc, I've been told I've got this narrowing of the spine called spinal stenosis at both ends, at the neck and at the lower back as well. And so so then I realised, okay, now I know why this man has been served to me, why he's talking at me. And so he goes on to explain about how, you know, he was carrying out this surgery, and he was kind of seeing like 2 kind of buckets of people. And the one bucket would be people that probably are not doing very much. So, you know, obviously his job was to be going in and fixing these discs, or, you know, shaving them, or it might have been that he's putting pins in the back as well to kind of help with alignment and stuff. And it's a difficult one, surgery. I mean, for me, my bulging discs, which have been there for some time, but now we've moved from 3 to 4, mine can't be operated on. I've been told they're not at that level where they need to be operated, as in they've not completely kind of ruptured, or they're not at that stage where they're going to be rupturing, so they're kind of hanging on for dear life. But, you know, again, it might be that you're listening to this and you might be in the same boat that I'm in. And, you know, I've done a lot of research recently, especially when it comes to this back issue, and there's a lot of people in my boat that are possibly not at the stage where the discs are completely rupturing, but we're experiencing a lot of pain. And from listening to another sort of neurosurgeon, he was kind of saying that possibly the people that are in my boat are in some ways worse positions, because it's a lot harder for people in my position for our discs to heal. So some people may have a really severe bulging disc, and it might be that after a few months it's gone back in and it slipped back in quite nicely, whereas for myself that's not the case, and for probably other people that's not the case as well. But our discs are not severe enough to be operated on, and that, I think, is the difficult one, is because there's no hoping that it can be surgically fixed. But then there's also this thing where, okay, well, we've just got to live with this thing, and that is the difficult side of it. But anyway, getting back to this neurosurgeon. So he was kind of saying that there's 2 buckets of people that he sees, and there's one bucket who don't tend to exercise, they're sitting for very long periods of time, and they don't eat and drink well. And these patients, they tend to have the surgery and then sometimes need further surgery. And then there's the other bucket where these people are exercising, they ate more of a plant-based diet and ate very little animal produce. And it was nice that he said that he doesn't believe that, he's not an advocate as in for that everybody has to, you know, become vegan, or, you know, has to eat just totally plant-based. And I'm the same as well. You know, I would call myself a plant-based eater, but I do eat animal produce, and a small amount of it. I don't eat a lot of it. And then he also said that these people as well, they tend to not drink alcohol, and they didn't smoke. And so in that bucket of people, the people that kind of had a bit of a cleaner way of eating, and they tended to move a lot more. There were times where with these people, a surgery would be scheduled, and then when it was time to do the surgery was no longer required. And the reason why with the second bucket is that they healed themselves naturally. And it was so nice for me to hear this, because, you know, I've practiced nutritional therapy for a long time. You know, I've seen clients with nutritional therapy for many, many years. And I qualified in nutritional therapy in 2007. And so back then it was quite, and even with yoga as well, it's been quite a battle at times, because even when people have seen me for yoga and I've kind of explained things to them and I've said to them, you know, go back to your doctors and explain this, like what I'm seeing. And then when they've gone back and explained, oh, my yoga teacher told me this, then it's been met with very, not very nice comments coming back, you know, in favour of, you know, this woman who's doing this holistic kind of stuff is kind of saying this, that and the other, and, you know, don't listen to her. That's how it's kind of come across. And so it can be quite difficult when you're in this field to have, in the past, I think it's definitely changed. In the past, it was very difficult because you were seen as being a bit of a quack, being a bit woo-woo, and that's not the case, you know, not at all. And so it's really nice now to see that in conventional medicine that there's this kind of feel now that, yeah, if we can do some of these like holistic kind of practices, if we can change the diet instead of having to force and give out medications all the time, if we can change lifestyle when it comes to exercise, instead of going in and straight away operating and fixing, inverted commas, the problem with surgery, then it's so nice now to hear that, you know, we can kind of work in tandem a bit more when it comes to conventional medicine. And that's what I'm all about. You know, I'm not all about going, because there's some people in my field that are all about going purely in the holistic alternative medicine route and ruling out conventional medicine. And for me, no, I think we should be working together. I really feel that that's how it should be. And so, you know, for me, I'm not against surgery. Okay, but if you need to have it, then you must have it. But I've really seen the power of how natural foods and movement and what it can do. You know, I've seen people with their diseases that they may have battled with a certain disease since their childhood, and then by just doing yoga and doing simple breathing practices, it's gone. You know, and things where it might be anxiety and they've been crippled with anxiety for decades, and then they come and start doing yoga and doing breathing practices and doing meditation, and then it's gone. You know, it's been wonderful when I've had ex-students that have said to me, you know, I've been scared of going on a plane, and, you know, I just did your breathing practices and I didn't need to take Valium. And just hearing that, wonderful. Or people that are having issues with sleep and they're not able to sleep, they come to a yoga class, and then that's the best sleep that they're having, that they've had for years. And so, you know, it was really nice to hear and listen to that and watch that video. I just thought, yes, at last, maybe the message is getting out there now that, yeah, we can bring these two worlds together and they can do miraculous things. You know, can do that. And so for me at the moment, you know, I am battling with this back issue, which, you know, I'm going to beat this. And, you know, alongside my other illnesses, and I've been told again that there is no cure. So I've been given the kind of doom and gloom scenario. But even for me, I am feeling and seeing improvements in myself every day. So now I can walk, where a few months ago I couldn't walk. I'm not experiencing the levels of pain that I was experiencing. I am still having daily pain, but it's nowhere near as what it was before. And I do put a lot of that down to the way that I eat. I do put a lot of that down that I move a lot. As soon as I could start moving and walking, then I kind of built up my movement. And now my walking now, as you know, started with a 5 to 10 minute walk, and in the last week or so I've been managing 20 minutes and not really having much pain with it, which has been fantastic. So no, just have to keep doing these things over and over and over again. Now, there was a part of the video where he does go on to say that he feels that the medical profession, if they were to kind of be recommending diets and movement as a requirement to heal, then the medical profession wouldn't earn their money. And so, you know, it would mean that if they were recommending these sort of practices, that they wouldn't be earning, you know, they'd have to be laying off people. And I just thought that's so sad. That, I mean, that I'm not saying that is the case, but that's what he believes. And I just felt like, how sad is that they have to, it's kind of, health has become this business really, that they have to be not recommending things like that are free. They can't recommend those kind of things because this has become a business. And I know it's different in different parts of the world. So, you know, over here in the UK, I'm taking it that this guy is in America. And so, yeah, the structure of how we do things over here in the UK is different in some ways, but we are kind of becoming more and more like America in the sense of what he was explaining in that way. I don't want to go into that into too much depth. So what I'm saying, like the neurosurgeon, I'm saying that if you want to heal your body, and when I say heal your body, this isn't meaning about you're going to remove everything from, you're going to wake up one day and, oh, I'm cured, it's gone. No, I don't have to deal with these things anymore. No, I'm not talking in that way, But what I am saying is that if you want to be experiencing less issues with symptoms on a daily basis, then really look at your diet and really look at your movement, because it can hugely help. It's not going to give you quick results. So it's not going to be that you take this pill and your pain is gone, or you take this pill and your disease is gone. It's not going to do that, but it could save you surgery. And listen, for me, I have ducked out of surgery quite a bit. And the big one for me was in 2007 when I was diagnosed with Graves' disease. And my diagnosis of Graves' disease, back then, it was life-threatening. So I was experiencing what is called a thyroid storm, which means that your thyroid hormone levels are off the charts, and it becomes very dangerous. I mean, Graves' disease is something that can kill people, and my levels were very dangerous. And I just had a baby, so I'd had my second child in 2006, and I also had a child in 2005, and they were pushing me to have this treatment called radioactive iodine, which means that kills off your thyroid. And so there was options where you could have this radioactive iodine, or they could go in and remove my thyroid gland. So those were the two options. And I was being pushed to have it. And with the radioactive iodine, it means that you can't be in contact with people for around 6 to 8 weeks. And at that time, I had a 6-month-old baby, and I also had a 2-year-old toddler. And I just thought to myself, can I be away from my children, locked up in the same house, but can I be in a different room from my children for 2 months? And when I weighed up the scales, I just thought, well, this is impossible. How on earth can I do that? I can't do that. So I kind of begged and pleaded with these people, and I said, look, I can't be away from my children for 2 months, and I want to see if I can see what will happen if I can in a few months' time. And in my head, I was thinking, well, at this time I was trained as a nutritional therapist, and I'd beaten not beaten because it's still with me, but I'd managed another disease. And I just thought, well, I'm going to manage this one as well. And so that's what I did. I completely changed my diet. Had to eat very differently now with having this autoimmune disease. And then within about a year, the medications that I was on, literally stripped them away. I didn't need them anymore. And I had healed myself. And I also had to change things what I was doing with yoga, because sometimes, again, like I'm experiencing now with this spinal stenosis, some things that I was doing with yoga was making things worse when it came to Graves' disease and my thyroid. And so with kind of like adapting things, I managed to heal my body. And not the thyroid, you're not looking at just healing a gland, you're looking at healing the whole body. And so in the end, I didn't need the surgery, didn't need to take radioactive iodine, and I take no medications for Graves' disease. So I managed to get off taking medications. And so, I mean, I am kind of, I suppose, an enigma in some ways, because, when I have to go to the doctors or whatever else, they always ask, especially if it's somebody new, so you have Graves' disease? Yes. Do you take medications? No. So how are you doing this without medications? Diet and movement. Okay, enough said. Then that's it. We move on, and they look at me gasping, like, say, oh my word, because they can't believe it. But it can be done, and I've done it already. And so, again, I'm not saying that I am against surgery, because I have had surgery for other things. And if your disease is extremely serious, then yeah, surgery is definitely needed. But I do think you can do things. Not saying that surgery won't be required, but you can do things just to help with managing your disease. All right. So I'm here to say, just go and give it a go. So go and give it a go. It might mean that you still need to have surgery. Who knows? But wouldn't it be better that, wouldn't it be so helpful that you could be doing things just to help heal the body? It would be so good that you could be doing things just to give you a better quality of life. Wouldn't it be so much better to do that? Right. So I think I'm going to finish off there. So I will put a link to the video that I watched on YouTube. I will just say as well, it's a 50-minute video. So if you are ready to watch it, and you've got about 50 minutes of time to devote to it, then do it. And if you are somebody like me who's got issues with their back, with discs and stuff, it would be good to hear this guy out and hear what he's saying, and to give, and I suppose it's just to give you hope as well, because I've been in the last few months weighing up my options, you know, because in the beginning of all of this, you know, I was told that, you know, your options are to take this medication, which some of it I'm still on, which I'm not really happy about taking it, but, you know, I'm hoping that as I improve, I'll start to wean off this medication, just like I did with the Graves' disease. And then, so that's one option is medication, pain medication as well. And then the other option is to go in and have steroid injections within the area, and so that might be another option. I've not explored that part yet. And then the other option is surgery. And then when you go in and start kind of looking at things online, and you're looking at all these different worlds, and, you know, you'll have some people who say, yeah, I've done the surgery and it's the worst thing that I ever did. And then some people say, yes, I've done the surgery and it's the most fantastic thing I've done. Then some people say, yes, I've healed myself naturally. This is what I did. And I went off and did walks for hours and hours and hours. And you'll start hearing all this kind of stuff and this conflicting stuff. But sometimes it's good, I suppose, just to hear. It's nice to hear from a surgeon who is kind of, because a lot of the stuff that you might see online as well, sorry, I'm kind of waffling here, but a lot of things that you probably see online as well when it comes to surgery is people touting like their surgery, because obviously they want our money, you know. So there's that side of things. But it was so nice to hear this guy talking, because he's giving the two options and he's saying what he's observed in a very honest way. And I suppose he can do that because now he's an ex-neurosurgeon, and I suppose if he was still doing the job, he'd have to be giving off the messages that possibly what you and I see when some of these people are doing these things. And so, yeah, I will finish off there. But anyway, I will put the link to the video in the description area. So you have a fantastic, fantastic day. Take care, and I will be back soon. Until then, bye-bye.